So your background is in pharmacology. That means you're a pharmacist, right? No? Oh, okay. And you have a background in something called toxicology as well? Hmm. In this video, I want to talk about the sister sciences of pharmacology and toxicology. Welcome back to my channel. My name is Dr. Anwar Youssef Dunbar, and this video is a discussion about the sister sciences pharmacology and toxicology. Well, I consider them to be sister sciences, and I think when this video is over, or when this series of videos is over, I may have convinced you that they are sister sciences as well. Please like the video, please share it if you see fit, and please subscribe to my channel. I previously made a video just on toxicology, and I was going to make a video just on pharmacology, but I thought that it would make for a more intriguing video or set of videos if I talked about them together, as many of their principles are similar, and as you'll see, they both deal with what molecules do to living systems. So before I go on, I just want to rehash the mission. As a minority scientist myself, I think that one of my callings, or one of my contributions, is to expose underrepresented minorities to the sciences, and populations who to the sciences who otherwise would not have exposure to them. And once again, less than 10% of STEM degree holders are Black/African American. So one of the challenges for this video and for this series is to do these sciences justice from a condominium unit in Northern Virginia. So I'm going to do the best that I can, and I'm going to think about the best ways to proceed forward with this material. But if you have questions as I go along, please leave those in the description box below. I want to shout out one of my most loyal followers, Miss Burdine, as she always has questions. And as we know, asking questions is a major part of the sciences. So please ask as many questions as you want, especially if you are confused about something. So what is pharmacology? Once again, there's going to be a blog post in the description box below with all of this written out in a very logical format, and I wrote that blog post. Actually, that was the first in this series initially, but I wrote that up so that it would be understandable by the lay person. And I want to shout out one of my most loyal viewers, Miss Burdine. She always has a ton of questions after I make these science videos. So if you have questions, please leave them in the comment section below. No question is stupid. And a senior scientist once told me that the only dumb question is that which goes unasked. I think that's how it went. So ask questions. That's a part of, questions are an integral part of science. So in any case, what is pharmacology? And how is that different from pharmacy? I get that question all the time, and that question was the genesis, or should I say, the impetus for me writing the pharmacology blog post in the description box below. So I get that question all the time. When I meet people on the street, when I do career fairs, everywhere. What is pharmacology? Is that the same thing as pharmacy? And actually, no, it's not. They both deal with drugs, but one has a more clinical focus and the other one has more of a research focus. And so when you think of pharmacy, a pharmacist is a medical professional who specializes in what medications do and how and their therapeutic benefits and effects in patients. That's a pharmacist. A pharmacist is the individual you talk to in CVS or Rite Aid or Walgreens when you get a prescription from your medical doctor. That's a pharmacist. A pharmacologist is actually a research scientist who works in a lab doing experiments, asking scientific questions with the hope and the goal of creating more new or more effective medications like this here. This is ibuprofen. So one is more of a clinical discipline, the other one is more of a research discipline. And with that, I'm going to go a little bit deeper and talk about the difference between the two. So the difference between pharmacy and pharmacology. So one of my professors at the University of Michigan actually told us a riddle in class that I still remember to this day. And it's a really good way to think about how the two disciplines are different. So this professor in our Principles of Pharmacology class said, pharmacy is the study of what drugs do to man, and pharmacology is the study of what man does to drugs. So let's unpack that a little bit. So going back to what I said in the previous section, a pharmacist is a master of what this medication does to patients. So they have to be knowledgeable on what the medicines they're prescribing or the medicines they're dispersing do. And that's why they always ask you when you go to CVS or Walgreens or Rite Aid, do you have questions about this medication? The pharmacist has to be in contact with your medical doctor, and the pharmacist sometimes always has to be in contact with your nurses. I actually was a TA, a teacher assistant, for a nursing pharmacology class at the University of Michigan, when I was a student, and the professor there actually said that the nurses are the last line of defense between the medical doctor and the pharmacist. And the point was that oftentimes medical doctors make mistakes. So it's the nurse's job to catch any of the doctor's mistakes. And then it's also the pharmacist's job to catch any of their mistakes. So in any case, let's go back to our little riddle. So the pharmacist is the master of what the actual medication does to the patient. But the pharmacologist is in the research lab trying to figure out how to make new medications or how to make existing medications more effective and in some instances less toxic. Here's an example. So this medication here, this is ibuprofen, and I'm going to open this up. When you pour this out like this, all these pills come out like that. These are brown, round tablets. What this pill is, or should I say all this pill is it's a very concentrated preparation of a molecule. A drug can either be a small molecule, which you usually take orally, or it could be a large molecule, which has to be injected into you. But the point is that that pill is made up of these molecules, like this. And so let's say this molecule, we know that it's a medication for heart disease, but we know that it's toxic. So while it provides a therapeutic benefit, it's toxic to the patient. And it's toxic because of this double bond here. So we're putting our chemistry hats on a little bit. So the pharmacologist says, okay, we know that this medication is toxic because of this double bond here, and we know that the active portion of the molecule is here. Let's just take this piece of the molecule off, and we'll give the patient this piece. So now we'll have the therapeutic benefit here without the toxicity here. That's what a pharmacologist does. They're actually thinking about the scientific aspects behind the medication to either create a new medication or to make existing medications more effective or less toxic. So if you haven't, please like this video, please share it, and please subscribe to my channel. So optimizing a drug's structure to maximize its therapeutic benefit is just one part of what pharmacologists do. There is also the identification of drug targets, and there is also the optimization of the drug's delivery to that target. And I will probably cover that in another video, as it's a whole discussion all in itself. But where does toxicology fit into all this? Well, remember that toxicology is the study of a chemical's harmful effects, while pharmacology is the study of a chemical's or a molecule's therapeutic effects. And where they overlap is that in both cases you're looking at the effect of a molecule, usually a xenobiotic from outside of the living system. You're looking at the effect of that molecule on the living system. So while drugs are in theory designed for a therapeutic benefit to treat disease and sickness, they can also cause toxicity. So if you go back to my toxicology video, or if you take any toxicology class, one of the things you learn is that even the most benign substance, if consumed or if the organism is exposed in too large a quantity, even the most benign substance can be toxic, such as water or sugar, for example. So going back to the toxicology of drugs, so once again I'm going to differentiate between the clinical side and the basic research side. So medical doctors, nurses, and pharmacists must all have some knowledge of toxicology in addition to their knowledge of pharmacology, because once again, the drug, if taken in too large a quantity, or if it's allowed to build up in the living organism, the drug can become toxic as well. Pharmaceutical companies have to have toxicology divisions, and from the instant they start working on a drug target and characterizing it and bringing it through the what they call the drug pipeline, they have to actively characterize its toxicity and consider its potential toxicity in patients. And this is so there are experiments that take place during the development of the drug, and then once it gets further along in the pipeline and passes all the animal studies and in vitro studies and all those things, it can eventually go to clinical trials. And if you haven't heard of what a clinical trial is, that's where they actually start testing the drug in patients, in which the pharmaceutical company has to enlist the help of medical doctors and nurses and so on. But there are two phases to the clinical trials. There's phase 1, which tests for potential toxicities and side effects. And then there's phase 2, which tests for efficacy. So then that's trying to assess how effective the drug is at treating that potential disease, whether it's diabetes or HIV, AIDS, or arthritis or whatever. So yeah, phase 1 clinical trials and phase 2 clinical trials. So in the case of, let's go back to Michael Jackson's death. Well, that was, in essence, a toxicology story. Propofol, Dr. Conrad Murray was treating Michael Jackson with propofol, which was, well, actually is a sleep medication which works through activation of the GABA channel. That's an acronym for gamma aminobutyric acid. I think I got that right. And that channel has an inhibitory effect on the central nervous system, which I'll discuss later. And that's why it's used as a sleep medication, because it depresses biological activity and induces a sleep state, which is what Michael needed in his last days because he couldn't sleep. So Dr. Murray either prescribed too much of the drug to Michael, or Michael's body couldn't clear it fast enough and it built up in his system and he overdosed on it and it shut his system down and he died. So that was a toxicology story. So while pharmacology and toxicology have different focuses, many of the tools are the same. So pharmacologists also highly consider dose responses. So does treatment of your in vitro system or your cell culture or your animal, do increasing concentrations cause the desired effect in your in vitro system or your cell culture, whether that's cell division or activation of DNA? Does it cause the desired effect in the animal, whether it's something acting on the heart or something acting on the respiratory tract or something killing a bacteria or a virus? And when you get to clinical trials, does increasing amounts of the drug treat the disease and in increasing manner in terms of efficacy? Also, is when you're in the experimental phase, is your molecule, does it exert its function or its action in a pharmacological concentration? So is it specific? Is it potent? Can you start the effect and show the effect at very small amounts? And if you can show it at very small amounts, that indicates that it's pharmacological. So a small concentration versus a very high concentration. And I'll talk about that later. Let's see. Pharmacologists are also concerned about routes of exposure. So will the drug be given orally, or will it be given dermally, or will it be inhaled? When I think of inhalation of drugs, I think a classic example is albuterol, which is what individuals who suffer from asthma, they pull out their inhaler and they inhale albuterol. So a drug can be given in 3 ways depending upon the sickness or the disease state. And then the final consideration is, what is the drug target? And I think that's kind of considered in toxicology as well. What's the target of the toxicity? But for a therapeutic, that's of the utmost importance, and I'm going to talk about that next. Drug targets and what they are and what their significance is. This video will be continued in part 2 of Pharmacology and Toxicology, the Sister Sciences.